And we're live.
Okay. Hello and croeso, welcome everybody. I'm Gareth Thomas. I'm the Deputy Director for Admissions and Recruitment here at Cardiff University at the School of Healthcare Sciences. And we're glad to warmly welcome you to our webinar this evening where where I'll introduce the various programmes and the academic lectures from each of those programmes concerning allied healthcare. So just to give you a bit of background about Cardiff University, it's a Russell Group University and was established many years ago. Okay, and we are recognised for high quality teaching and research, and 90% of research is proclaimed as world leading or internationally excellent. We have approximately 28,000 students at Cardiff University. Okay, and we are divided into 3 colleges. All right, arts, humanities and social sciences, physical sciences, and biomedical and life sciences. And our school, School of Healthcare Sciences, come under that College of Biomedical and Life Sciences. Also, for you to know that we are not the only university that's situated in Cardiff. There are other universities such as Cardiff Metropolitan University. Okay, also University of South Wales has a campus based in the city centre, and also we are home to the Royal Welsh College of Music and Drama in the city centre. So it's a very big hub, vibrant group of students living and breathing in the most amazing city that is Cardiff. As you know, or as you might be feeling, that going to university can be a bit of an overwhelming experience. And to help you to adjust that, we have a huge amount of support available to you, which is all centered in the Centre for Student Life, or CSL. Okay, that is centered right in the hub of the city centre, right in that middle of all the university. Okay, and is designed with your experience in mind, ensuring that your student education experience is looked after to ensure that you get that good student experience and that support right from the beginning to the day you graduate. Okay, and perhaps thereafter. Okay, so there are support where it comes to your money matters or financial aspects. Okay, also your future career and employment, so such as job finding or teaching, giving you support to create your CV, for example, or interview experience. There's also health and well-being, okay, which is taken very seriously. Okay, also the student disability service, okay, to provide you the support for any disability, okay, during your time at Cardiff, and also help and assistance in terms of your study skills and those academic skills, okay, to support you when it comes to perhaps your academic writing, your assignments, okay, perhaps learn how to, taking notes, for example, during various lectures or tutorials during your time at Cardiff. As I said, the School of Healthcare sits in the College of Biomedical and Life Sciences, okay, and we are recognised for excellent learning, teaching and research, and we are based at the Heath Park campus, okay, which is about a 20-minute walk away from the city centre, okay, which is home to the University Hospital of Wales, okay, and the Dental Hospital, and situated on Heath Park campus, we've got the Heath Park Students' Union, the IV Lounge, the Cochrane Library, okay, as well as a student support hub, okay. Home to us is both Heath Park West, which I'll discuss a bit further on, and also T. Dewey Sant, okay, which houses us lecturers, some of us lecturers, okay, but also the learning spaces, okay, where the hub of the learning takes place and any simulation. Okay, so not just lecture theatres, but we also got classrooms, okay, all depending on the content, I suppose, that's being delivered. Okay, we're also home to clinical skills facilities to get you on board with those clinical skills to prepare you for the hospital environment. Also, we are quite on board now with virtual learning. okay, or virtual learning environment suite. Also VERT, which is linked to radiotherapy. I know that Erica will allude to that later, as well as the mold room, which is concerning the radiotherapy and oncology program. We have a brand new X-ray facility, okay, X-ray room, all right, which mirror any modern X-ray department that you'll find in today's 21st NHS, okay. Also, we're home to some physiotherapy simulation labs and also home to a research centre for clinical kinesiology, which no doubt Jodie will refer later on in her presentation concerning physiotherapy. So Heath Park West opened not so long ago, okay, and it's a dedicated teaching facility for skills and simulation, as you can see in the pictures along the right there. Okay, also large plinth rooms for physiotherapy practical skills, and a home environment flat that we use to support occupational therapy, okay, for assessment, preparation and application of your theory into clinical practice before you go out free to real live patients, okay. Also it's home to where we do manual handling and basic life support skills, and booths for developing your communication skills, and not forgetting those relaxation areas for catching up with your friends, okay, with a coffee shop and sort of I would say a lounge where you can just sit, breathe, relax, okay, to eat or drink, okay, in between your lectures. Each team tonight will explain the role of their profession, and on each PowerPoint slide there's a QR code which will lead you to the information concerning entry requirements and a bit of an overview of each of the professions, should you need to delve a bit further if there's something that you find being broadcast tonight that you want to dig a bit deeper. So those QR codes will lead you to the information, particularly in terms of the course entry requirements, skills, what sort of person we're looking for in each of those programs, okay. So I'm going to begin tonight with radiotherapy, okay, and I believe Erica, who is a radiotherapy and oncology lecturer here at Cardiff, will give an overview of therapeutic radiography and oncology.
Thank you very much, Gareth. So my name is Erica Chivers, and as Gareth said, I'm the admissions tutor for the Radiotherapy and Oncology degree. Our Radiotherapy and Oncology degree leads to eligibility for you to become a therapeutic radiographer. So this means that we're registered with the HCPC, which is our registration body. So the Health and Care Professions Council oversee our degrees, and they ensure that the standard across the United Kingdom is consistent. For you to be able to be a therapeutic radiographer, you have to register with the HCPC. So first of all, I wanted to tell you a little bit about a therapeutic radiographer's role. We are specialist staff that specialise in radiotherapy. So we look at the planning, so this is the preparation of our patients for their radiotherapy. We deliver the radiotherapy treatment itself, and as you possibly are aware, radiotherapy involves very, very high energy X-rays in large radiation doses. So we are very, very specific and very, very particular in the way in which we deliver radiotherapy. Because we are using very high energy radiation, then our patients have to be treated with millimeter accuracy. Most of our patients have a diagnosis of cancer. We treat patients of all ages and all varieties. So we treat patients from young children all the way through to those people who are quite elderly. Occasionally, we will treat benign, that is non-cancerous conditions, but the majority of our work is working with people who have a cancer diagnosis. As I mentioned, we are very specialised. We are the only healthcare professionals who train solely in cancer treatment. And as well as operating a wide range of very, very sophisticated and complex equipment, we are responsible for the care of our patients. So I've put a couple of pictures up just to show you the sort of equipment I mean. The sort of equipment is called a linear accelerator. And a linear accelerator is a large, complex piece of equipment that can look pretty imposing and quite nerve-wracking for our patients when they first see this equipment. So our role is to work with the patients to help them relax, to treat the patients. So we need to gain the patient's trust as we are treating them, because we are asking them to lie close to very sophisticated equipment. So communication skills are very, very important, and we support our patients throughout the time. We have a very, very strong evidence base, and I think it's important to emphasize that, because the delivery of radiation has to be very specific, and it has to be very, very well justified. As Gareth said, the QR code that leads to our programme is on this slide here. And additionally, I've put a couple of possible links that you might find useful to have a look at radiotherapy. So I've put a link to our professional body, the Society of Radiographers, and then some other links to bodies called Radiotherapy UK, and they have lots of resources that show about the career in radiotherapy. So if you're interested, I would definitely encourage you to have a look broadly, because therapeutic radiography is not particularly well known. Could I have the next slide, please? So what about our programme then in radiotherapy? So our degree is a Bachelor of Science with Honours in Radiotherapy and Oncology. And as I said, it leads to registration with the HCPC, so you can work as a registrant, a therapeutic radiographer. In order to achieve this, we have a mix of academic and clinical modules, and we support you at every step of the way. We are all specialist academic teaching staff. We have research expertise and particular expertise in different areas of radiotherapy. Alongside us, we work with clinical radiographers, so you would be based in radiotherapy departments to learn the practical aspects. When you're based in the radiotherapy departments, we have specialist staff, clinical tutors, who support you. So they're our link between the academic environment and the clinical environment. And that's a really important thing as far as Cardiff University's programme is concerned. We're very lucky to have this provision, because not all departments, or not all universities have this specialist provision. Through our programme, you have the opportunity to learn across 4 different radiotherapy departments, and these are all state-of-the-art radiotherapy departments, and they all employ specialist staff who work at various disciplines. Our students would rotate through all 4 departments, and our clinical placements start in year 1, so we have 2 clinical placements per year, so that's 6 clinical placements in total across 4 different radiotherapy departments. That enables you to be flexible, to learn different techniques, to be adaptive, and to be able to care for your patients. We use lots of different teaching methods. We have lectures, seminars, tutorials, and lots of practical sessions, because we very much believe in doing as a part of learning. Gareth has mentioned our virtual environment radiotherapy. Virtual environment radiotherapy is a very specialist piece of equipment. It's a computer simulation of a radiotherapy machine. And you will learn on this equipment. So you'll start learning at the beginning of year 1. You'll continue your learning through years 2 and 3. And this is an environment where there are no patients. So you'll be able to rehearse radiotherapy skills, learn about anatomy, and look at radiotherapy planning. So it's a very important feature of radiotherapy. As well as having radiotherapy, the VERT room, we also have what we call VERT on demand, which means you can access this equipment on your own computers. So you can learn both at home and in Tydewissant. Our assessment goes across all 3 years, and we match it very closely to the academic materials taught and how you will work in the radiotherapy departments. So we're looking at that link between academic and clinical practice. You have the opportunities to take electives abroad, and this is a period of time where you're supported to go to another country, and you'll have experience in a radiotherapy department, and our students also have really good options to have a look around some of these places, and they all come back having had a fantastic time. So some of the places that our students have been to recently include New Zealand, Canada, Switzerland, Cyprus, Malta. So a very wide range of different departments that you can visit with support from the radiotherapy team. So we are looking for people who have an interest in patients. This is very much a care-based job where we are supporting patients through a really difficult time in their lives. They have been diagnosed with cancer and they are having treatment for their cancer. So we're looking for people who are interested in people and those who would like to support patients. On top of that, this is a very science-based job. Working with radiation, directing radiation at patients' bodies, means that you need to have a good understanding of what you're doing. So we are interested in people who have a science qualification, and we would be looking at least 1B in a science A level. Thank you, Gareth.
Thank you very much, Erica. And now we're going to move over to physiotherapy.
Thank you, Erica. Thank you, Gareth. Croeso, welcome to all of our Welsh speakers and everybody who is on the call this evening. Thank you for taking time out this busy time of the year to join us this evening and to find out more about the allied health professions' roles. If you do have any questions that kind of come up as we're kind of presenting the information around our programs, there is the Q&A option that should be on the top of your screen. So please do jot down any questions, and the whole team in the background here will attempt to answer those as we're working our way through those programs. So as Gareth mentioned earlier, you can see there that we've got the QR code on the first slides here. So if you do want any extra information, especially around the entry requirements, please scan the QR codes as you're seeing them. And the current QR code on screen is for physiotherapy. So I will start by introducing myself. So I am Jodie. I'm the admissions tutor for the physiotherapy programme at the moment. And I have a background in working in paediatrics, working in children. I'd also like to introduce Paul, who's here this evening. And Paul is our programme lead.
Good evening, everyone. Yeah, as Jodie said, my name is Paul Adamson, physiotherapist by background. And my role really in terms of kind of current role is the undergraduate programme manager for the BSc course. I'm supporting Jodie with this evening and I'm happy to handle any questions that come up.
Thanks, Paul. So let's start with, as Erica did, just giving you an overview of the physiotherapy role and what physiotherapy is. So the definition that we've got on screen comes from the Chartered Society of Physiotherapy, and that's a really good resource if you're a bit unsure and want a little bit more information around the profession. But I'm going to try and give you kind of a bit of a summary as well as to what physiotherapy is. So physiotherapy really is around optimizing somebody's function, and that can be in a whole range of different specialities and all of the way through the life cycle as well. And when we do these sort of open days and the webinars, it really gives us an opportunity to kind of reflect on our own careers and kind of what physiotherapy has meant to us. And physiotherapy has given us opportunities throughout our career, numerous different opportunities, and that might be the options to work within the NHS, options to work privately, options to work within sports, elite sports, maybe in research, leadership roles, and then academia, as Paul and myself are now doing. So lots and lots of different kind of skills that you get from training to be a physiotherapist, and lots of different ways that you can apply those skills. Also, we have the opportunity to be a part of somebody's life, and kind of that's really reflecting on that. It's a really precious thing to have been a small part of somebody's journey. And when we think of the people whose lives that we've touched along the way of those journeys, it could be that, you know, the people that you train with at university, they end up being life friends for life. Maybe the people that you meet as colleagues as you're working through the career, they become friends. Not then forgetting the patients that you work with, their families, or the students that you work with. So being a part of their journey is really, really special. And as Eric has said, that kind of needs you to be somebody who really does want to work with people. Then thinking about the life cycle, so you'll find physiotherapists at every stage of the life cycle optimizing function, trying to allow people the best quality of life. So if we think at the start of life cycle, or even actually before a baby's due to be born, so if a baby's born prematurely, they often end up on a neonatal unit. And you will find physiotherapists working in neonates. Now, that could be specialising in cardiovascular respiratory. So that physiotherapist has specialist knowledge of a newborn baby that was born prematurely that maybe isn't able to breathe on their own. And they have those specialist knowledge and skills to be able to position that baby to optimise their breathing, to allow them the best chance of surviving and developing and thriving. You may also find in that environment a physiotherapist who has specialist skills in neurodevelopment. So that physiotherapist has skills on knowing for that baby who should still be in utero and shouldn't be subject to gravity, actually what's the best way to position this baby so that they're going to be developing as normally as possible, and kind of educating the rest of the team within neonates and also the family around that baby on how best to handle the baby. So that's neonates. We move then into pediatrics, which is my area of speciality, and I could probably talk all night about it, so I'll make sure I keep it brief. I worked in the Children's Hospital for Wales, the Noah's Ark Children's Hospital for Wales, on the site actually that the university is based for healthcare. And within that hospital, there's a huge number of different specialities within paediatrics. So there's an intensive care unit, for example, where critically unwell children will be treated, whether that's because of an injury or because of a condition, or this time of the year, for instance, maybe due to flus and viruses. And those children could be on life support machines. A physiotherapist can have a role in trying to keep children's chests clear, and not just children, adults as well, but within that kind of children's hospital, that was one of our roles. Also, there's an oncology unit, so there'll be children who sadly are affected by cancer, and physiotherapists have a role optimizing their function around their really grueling and debilitating treatment, whether that be radiotherapy or chemotherapy. And physiotherapists have a role there. Trauma and orthopedics, so for instance, we might get children who've been on a trampoline, had an accident, fractures, again, needing to optimize function in those children, maybe help them learn how to walk with a walking aid. Or maybe it's a child that's got a long-term condition, needing kind of help before surgery or after surgery. So you'll find physiotherapists in that environment as well. As well as the inpatient environment, you'll find physios working in an outpatient environment in the community, in special schools in paediatrics. There's a hydrotherapy pool in that children's hospital, so physiotherapists working with the kind of properties of water to help rehabilitate patients. I'll move out to paediatrics now because otherwise I'll get stuck. So we think now about maybe the role that most people are aware of within physiotherapy, thinking about musculoskeletal. So thinking about maybe working in the sport environment, or thinking about outpatients, where maybe somebody might present with lower back pain, for example, or knee pain, or after having surgery on a knee. So if we think about sports, we might have that preconception of physiotherapists running onto the sports field with their magic sponge and applying the magic sponge and then making that athlete better. Actually, that physio's got really specialist knowledge to actually be watching a game and to be able to predict what that injury mechanism might be, and then to be devising a treatment plan as they run onto the field and know what to do with that athlete. In outpatients, as well as patients being referred in through general practitioners to be seen for instance, shoulder pain, neck pain, back pain. This is an area now where physiotherapy, actually the scope is expanding massively. So now physiotherapists are actually able to work maybe as a first contact practitioner within a GP practice or in an A&E department, where you wouldn't need to go through a doctor first. You can actually see a physiotherapist first and they will triage you. They may also have specialist skills such as injection therapy, being able to order scans, for example, being able to prescribe medication. So a huge range of different skills there within musculoskeletal as well. We think about neuro, so kind of if a patient maybe is requiring rehabilitation following a head injury, a stroke, a spinal injury, for example, they could have real life-changing injuries or changes that they're going to require rehabilitation for. And not just thinking about the specialist knowledge and skills of that physiotherapist, but also thinking about the manner in which that physiotherapist is able to communicate with a patient or is able to show compassion or care. We may need to go into somebody who's had a traumatic event, maybe a traumatic amputation, and potentially need to go into them the very next day and say, oh, hi, I'm a physiotherapist. My name's Jodie. I'm here today to help you get up. And being able to do that and being able to empathise with the patients and being able to still motivate them in a sensitive way is a really specialist skill to have. And we can talk about all the different specialities of physio because there's a huge number of different specialities: mental health, pelvic health, for example, elderly care, palliative care, a huge range all the way through that life cycle, but I'm going to run out of time. So please do go and have a look at the Chartered Society for Physiotherapy and look at the kind of range of different areas that you might find a physiotherapist. Next slide, please, Gareth. So just very quickly, why physiotherapy at Cardiff University? Well, Gareth's given an overview of kind of the university as a whole, but just thinking specifically for the physiotherapy programme, physiotherapy has been at Cardiff for a really long time, so it's a really well considered and evolved programme. We've got lots and lots of experienced staff that work in all sorts of different areas and specialities that have clinical experience in the different specialities. Also, as being the Russell Group University, we've got a number of staff working in state-of-the-art current research as well that deliver teaching within the programme. Eric has also mentioned kind of some of the assessments. So within the programme, and I imagine it's similar across all of the programmes you hear about tonight, we really think about the assessment being authentic and being meaningful to the practice, to the profession that you'll be doing at the end of the course. So lots of our assessments, we don't actually have any written exams. Our assessments tend to be very practical, so either practical-based assessments, presentations, for example, vivas, or written assessments that are based around clinical case studies, for example. We also have placement experience within the programme, so we offer 7 different placements of 4 weeks in duration, and these currently sit in the 2nd and 3rd years of the programme, and that gives our students an opportunity to go out on placement across the whole of South, up into Mid and East and West Wales. So the only health boards that we don't actually cover in Wales are those in the very north of Wales. And this range of different placement opportunities allows our students to experience both inpatient, outpatient and community experiences and lots of different specialities as well. We also have a number of members of our staff who speak Welsh, and there are opportunities to study elements of the programme through the language of Welsh and also to be able to be assessed through Welsh as well. As you can see through some of those pictures there, it's really important just to show that we try to have as much fun, or hwyl as we say here in Wales, within the programme. So although you have to work very hard to come out and be a physiotherapist, we also play very hard and have a lot of fun around that as well. And as Gareth has alluded to, there's lots and lots of different opportunities within Cardiff University around different sports and societies and other kind of opportunities within the university as well as it being just an incredible, fun, green, lovely city to be in. Just a pointer as far as directing you to the QR code earlier and our entry admissions. The one thing that you'll find that we ask for, and any other Russell Group universities offering physiotherapy, is that we are looking for a B grade in biology, at least a B grade, and please do have a look at the entry requirements for anything else as well. So a huge thank you. Sorry, I've gone slightly over my 10 minutes, but a huge thank you for listening, and I hope you enjoy and are inspired by the rest of the programmes this evening. Thank you.
We could hop on to the next slide, Gareth, if that's okay. Hello guys, hi, I'm Andy McCluskey. I am the admissions tutor and one of the lecturers here at Cardiff in Occupational Therapy. I apologise for the voice, but there we are. Yeah, so this is just my opportunity to tell you a little bit about occupational therapy, and in the same way as sort of Jodie and Erica said before, if you guys have any questions, please make sure that you pop them up there and then we can respond to those a little bit later. But to start with, I just wanted to give you a bit of an idea about what occupational therapy is. And occupational therapy is all about promoting people's health and their well-being through occupation. So it's looking at what things people want to be able to do, need to be able to do, and supporting them in their expectations to be able to regain their independence in things. Okay, we work with people, we work with communities as well at a larger scale, all thinking about how people are able to engage in the things that they do every day. Our occupations, it's not just work. Okay, our occupations are absolutely everything that we do day to day. That could be getting ourselves up in the morning. That could be having our breakfast. That could be getting to work. It could be going out and playing rugby. It could be holding our granddaughter. Okay, it could be absolutely anything, but it's the things that are meaningful to us. And I think that's one of the things that I love most about occupational therapy is that when you're working with a patient, you're getting them to be able to do the tangible things that they want to be able to do again. And we use our reasoning and we use our assessments to be able to identify where those difficulties might be, so that we can then support them to be able to regain that independence. And we might do that by using an approach where we support them to improve their abilities. So say if I was working with someone who had a neurological injury, I might work with them in a sort of more remedial approach to develop their movement in their arm again so that they could eat their dinner, so that they could hold their grandchild. But I might also think about how I can modify that environment. So maybe they're not able to regain that movement. You know, you think about the examples that Jodie talked about where someone might have had an amputation, for example. Well, then we need to think of ways we can modify that environment to enable someone to be able to do it. And I think that's one of the big things, and it's probably true of all of us as allied health professions, is that we're not an island. We all work together and we all work across with each other, and you'll hear lots of common themes coming across in all the things that we're saying. And I think it's really, really important. And one of the important things for us here in occupational therapy at Cardiff is recognizing that occupational therapy is the way that you want to go. And I think taking a bit of time, and I've put a few links there at the bottom of this slide, to give you a bit of an idea and give you an opportunity to look at what it is that defines an occupational therapist. And I've talked about occupation, working with people, thinking holistically in the way that we work with people. If you go onto Google and just type in #ChooseOT, it will take you to the Royal College of Occupational Therapists, and then they'll give you in that link, it will take you to people's journeys, both with occupational therapy as patients, but also the experiences that occupational therapists have had working in the profession as well. I've also put a link there for the World Federation of OTs. But if I'm honest, the quote that I always go to is actually one that was given to me by one of our third years who finished last year. And they said, and this is better than I could ever say it in a million years, they said the heart of occupational therapy isn't found in the grand gestures or in the complicated interventions. It's found in the everyday, in the things that people love, the moments that give us purpose, and the small, meaningful occupations that quietly rebuild identity, connection, and hope. And I think for me, that just truly embodies what it is we're trying to do as occupational therapists. We know that there is a link between our ability to be able to engage in the things that we want to be able to do, and when we're not able to do that, that really impacts on our well-being and our health. And I think all of us can think about times when we've not been able to do the thing we want to do and the impact that that's had on us. So that's really what we're trying to do as occupational therapists and how we're trying to support people to live more independently. And you could be working in any setting, the same way as Jodie talked about. We work with people from before their very first day of life all the way through to their very last day. And I've worked with people across the lifespan as well. So I've worked with people, very young people who've had brain injuries, all the way through to older adults who've had dementia, and people in palliative care as well. And I think that's one of the big things about occupational therapy, is that you get the opportunity to work in so many different spheres and so many different areas. You're not constrained to a particular path. And actually, the more that you do, the broader understanding that you have of the people that you're working with. And that might actually be a really good time to skip on to the next slide, actually, if that's okay, Gareth. Thank you, because I'm going to skip ahead from actually what I plan to talk about now, if I'm honest. And I'm going to talk about our practice education. So over the course of this placement, over the course of this course, rather, you'll have 1,000 hours or over 1,000 hours of clinical placement, and you'll have a placement each year. But what we do in occupational therapy is, instead of giving you lots of different placements, lots of short, sharp little placements, we give you 3 long placements. So you have an 8-week full-time placement working in a clinical setting in your first year. In your second year, you'll have a 10-week placement. And in your third year, you're basically not here for the first semester because you're out on placement for 11 weeks. And over the course of those placements, instead of you dipping your toe into lots of different areas, because you could never cover all of the areas that OTs work in, what we do is we try and give you that opportunity to learn how to think as an occupational therapist, how to understand where our role exists as an occupational therapist, so that you can then pick that up and go and work wherever you wanted to go and work. I didn't have any experience of neurological settings when I qualified, didn't know anything about it at all, but I dropped into it on a rotation. And then I ended up working in it for 13 years and doing a master's in it. And then that drew me across to Cardiff University, and I did some research into road crossing for people who had traumatic brain injuries. And I moved into a practitioner role in clinical practice rather than an OT role. And that just came because I understood my OT skills, and that gave me that time to develop those clinical skills in that area. And so it gives you that ability to really, really lay down your OT process and then develop your specific knowledge in each of the areas as you move into them and as you develop. And so to do that, we have a really student-centered approach to our teaching and learning. So you're very active participants in your learning here at Cardiff. We use a lot of clinical simulation. I'll talk about that in a minute as well. But we use a lot of problem-based learning and appreciative inquiry-based learning. And what that means is that instead of us just giving all the information to you and spouting things out to you in a lecture room, we get you working in small groups. We get you talking to each other, interacting with each other, so that you can learn how to work as part of a team, so that you can learn different people's perspectives, so you can all bring this knowledge into it. And that takes me back to me talking about how as OTs, we don't exist as islands and we work as part of a team. And that's something that in clinical practice, I see a difference in the students, the occupational therapy students who come to me in clinical practice from Cardiff as compared to other universities, because they've got those skills to be able to work as part of a team, interact with their professional colleagues, okay, to be able to listen to other people and to work holistically with the patients that they've got. We use a lot of different learning opportunities. There's a lot of seminar work, a lot of case-based work. We use virtual reality and put you in simulated scenarios so that you can assess and evaluate people's performance in clinical practice. We use AI, so we create AI patients for you to interact with and develop those skills in a safe environment with your peers before you go out and do it in clinical practice. There are opportunities to study in Welsh. We have placement opportunities to study in Welsh as well in North Wales, because we've developed relationships with people up there, even though predominantly our placements are based down in sort of Southeast Wales. And I think we're a really friendly, really innovative and quite a dynamic team. We do adapt to the things that students want, and we adjust and shape things so that you have the best way of learning. I think that's the most important thing. If we can't do that for you as students, then how on earth do we then expect you to go out there and work collaboratively with the patients that you're working with? Okay. From an assessment perspective, much the same as with what Jodie said, we don't have any written assessment, any written exams, because there's no point in your clinical life where you're not going to have the opportunity to look something up. So the assessments we use are really authentic. They're based around case-based presentations or written essays based around interventions that you might use in a particular case in clinical work. You'll take part in some empirical research, doing a dissertation in your third year as well. So I'm just keeping an eye on my time, and I've just noticed that I'm running out of time. But as I said before, any questions you've got, please don't hesitate to pop them up in the Q&A, or either email through to hcareadmissions@cardiff.ac.uk and we can get back to you. But otherwise, thank you very much.
Hello everyone, my name's Gemma. I'm the admissions lead for the Diagnostic Radiography and Imaging programme. So thank you so much for joining us online today. So you've just heard from my earlier from Erica, my therapeutic colleague from the Radiotherapy and Oncology team, but I am the Diagnostic Radiography side of things. Okay, so we're slightly different programmes. So even though both career pathways come under the umbrella of radiography, we have very different job roles and scopes of practice within our patient's journey and sort of the general hospital ecosystem. Okay, so definitely have a look at both QR codes to see which radiography profession is for you, because they are both very, very different. So what is diagnostic radiography then? So our role is to produce diagnostic images to assist in the diagnosis, in the treatment and follow-up of disease or any sort of trauma-related injuries. We utilise a wide range of imaging equipment and radiographic techniques to produce high-quality images, and we can use things like electromagnetic radiation to acquire images. So using general X-ray and CT or computed tomography, which you might have come across in those types of scans. We also use strong magnetic fields in MRI scanners to acquire images. So these are non-radiation techniques, okay? And we can also use high frequency sound and radio waves to acquire images. So a lot of you might have heard of sort of ultrasound as a modality that radiographers can specialise in. So they use a lot of sound waves to sort of see things like checking babies when they're growing and doing sort of dating scans, but also they go into things like doing cardiovascular sort of work, and definitely very good for looking at the condition of the liver or sort of the gallbladder and looking at pathology such as gallstones and things like that. So we use a wide range of equipment. We are key members of the healthcare team, so we work very closely with doctors and other healthcare professionals to provide personal and supportive care to people of all ages. So a bit like all of our professions here at Health Sciences, we'll work from neonates, so babies that just born. We'll go and do x-rays on the ward as well. We have portable machines all the way through to paediatrics, adolescents, adults and elderly. So we operate a wide range of imaging equipment, which is available in modern medical practice. So we can go through some of the things here. So we've got different modalities. So basically, I think that there was a statistic recently that I think 90% of people who come in to the hospital require some form of diagnostic radiography imaging. So there's different modalities, and what I mean by modalities is areas that radiographers work in and can rotate round. So no day is the same. So if you love the blend of sort of physics with patient care and interaction, then our course is for you. So the different modalities or equipment that we go into that we can specialise in and sort of is part of a day-to-day running of a radiographer's role is computed tomography, magnetic resonance imaging, so you might know this better as MRI. We can do diagnostic ultrasound. We go into theatre. So in theatre, we'll be the surgeon's eyes pretty much. So if anybody's having kind of like a distal hip screw put in, or they want to put a stent in, sort of, or like a ureteric stent because somebody so we're the surgeon's eye. So basically we'll follow any wires or any stents being put in or any hip replacements to sort of see whether if the screws are in properly. We will screen using a theatre machine called a C-arm using radiation to sort of guide the surgeons to where the wire is, the wire's in the right place or not. So this is called like fluoroscopy type imaging, but this is in theatre. We also specialise in mammography. So you might have heard of mammograms, like doing breast imaging and breast screening for cancer and things like that. So as a radiographer, you can specialise in that, and there's sort of advanced practice pathways for mammography as well. So advanced practice is sort of in the form of reporting. So radiographers now are either reporting sort of MSK or musculoskeletal type images. We're also reporting abdomen and chest x-rays as well, and also breast images like mammography. So this is part of specialization and advanced practice. You might have also heard of sonographers. So they specialize in ultrasound and they do their own reporting of their own images as well. So there's a lot of scope to do advanced practice in if you wanted to report on images and help with diagnosis. Also part of our job role, we go into nuclear medicine or radionuclide imaging. They're both the same sort of modality. So with that, then we actually, instead of the equipment giving out a radiation, we actually inject the patient with a radioisotope, and the patient is emitting the radiation. So what the reason for that is because then if there's quite a lot of uptake, so a lot of activity going on different spots, hot spots of the image, we can tell where the cancer's spread to. But also with this, this is probably the only imaging modality as well that can determine function. So a lot of people who had COVID have had long COVID and reduced lung function. And we can see how much of the lung function has been reduced by from nuclear medicine. So it's quite exciting area of radiography as well. So definitely look more into that. And obviously the most common one is the general x-ray. So when you go into A&E and you sort of injured your leg or your ankle or your hand, and you'll go in for a general x-ray first, just to see if there's any broken bones, because this is the best sort of modality to see that. So we get everywhere. So a day-to-day, you could be on Monday, you could be in general x-ray, x-raying different types of people for different range of conditions, or working in fracture clinic. So anybody who's having follow-up will come have an x-ray with us, so we can see how things are healing, and then they may go on to be seen by the doctor and then the physio, especially if it's a musculoskeletal clinic. So we all work interprofessionally together. Okay, so this profession is very much a blended role. Yes, we do operate the equipment, we do acquire the images, but it's also a patient-facing role. And our programme has a huge emphasis on like professionalism, compassionate care, and focusing around and patient-centred care as well. So we are quite a patient-facing profession as well as the technology side. Okay. So we're quite unique because our profession seamlessly integrates science and technology, mastering sort of imaging systems and applying those physical principles that we're going to teach you to acquiring the best images possible to aid with diagnosis. We also have the human connection, the patient-facing connection as well, offering empathy, reassurance, and personalised individual care. And also you have that clinical responsibility that will help you and teach you, ensuring of accurate diagnoses and doing the best sort of care that you can provide to that person that will help guide those treatment decisions. Okay, so in essence, radiography is a profession at the crossroads of cutting edge technology and human compassion. So you want people to be compassionate and love working with people as well, and just wanting to like have that enthusiasm to an excitement of, right, I want to let's get the best images we can, let's look at what pathology there are, what's going on, thinking about those patient pathways, what further imaging do we need to do to help with this patient's journey, so it means that they're getting that treatment more quickly, because they've got that diagnosis quickly, so therefore their prognosis will be a lot better. Okay, so we do deal with a lot of physics and applying it, but obviously we never lose sight of the person in front of us, and we try and put the patient at the centre of the decision-making process. So you might see that on some of the images then we've got on the slide, there's a CT head image. So we will teach you how to describe and interpret pathology, such as this. I don't know if you can see my screen actually. I don't know if you can see my cursor, but this is a CT image, and this is an extradural hematoma. So we'll teach you how to interpret the images of not only looking at anatomy on radiographic images of different types, but also kind of like we'll teach you to sort of identify some of the pathology. Now, we're not doctors, so unless you're reporting radiographer, you can't do the report. But what's important about teaching you about identifying pathology is you're going to help with the patient pathway. So you can flag up sort of what if there's further imaging that needs to be done, rather than sending that patient away so they've got to wait another 2 weeks to come back for more imaging, that actually you can talk to the doctor there and then and make sure that they get all the images they need, the patient wise, on that day, to help with that. We also do another area I forgot to say that radiographers can specialise in is cardiovascular and interventional radiography, which is this image here. So what's happened is we've put a special X-ray dye into the blood vessels, which are highlighted in black here. And then what that shows is if there's any clots or occlusions or blockages. So then we can guide, work with the doctors and image while they're guiding the wire up past the blockage, then to put the stent in. So you're working a quite fast-paced environment, but you're working interprofessionally with the surgeons, the nurses, like all the other staff. You know, so we work with lots of people. This is our nuclear medicine scan here. So again, you can see the hotspots, and we've got ultrasound. So there is quite a lot to this, but we'll teach you everything you need to know. It is quite a full-on course. You will be in Monday to Friday with lectures for a lot of our the health sciences programs, but you do get in academic, you do get a block, you do get a half day on a Wednesday. So hopefully you can integrate with all our student union kind of clubs and things as well. Lovely. So as a diagnostic radiographer, you'll be responsible for providing comprehensive care for patients, as I said before, from newborn all the way up to the elderly. But it's not just producing images and interpreting images. It's also, by the end of the programme, you'll have a thorough knowledge of the professional and clinical aspects of diagnostic radiography. So it includes a wide range of imaging technologies that we use today. So as I said before, the career development opportunities, you can specialise in MRI, you can specialise in ultrasound, in nuclear medicine. You can also specialise in forensic radiography as well, apart from the reporting roles that I was speaking about earlier. You can also go into education, like I am, and you can also go into research. And in third year, you will get an opportunity to do some empirical research as well, and work with a supervisor to produce a conference poster as well. So, please can you go to the next slide, Gareth? Lovely. So what can we offer you at Cardiff University? So like the other healthcare professions, we are accredited by the Health and Care Professionals Council. So that's the HCPC, our governing body, and the Society and College of Radiographers we've been accredited by as well. So this is kind of like our union, but it also gives guidance for students and for policies and practices as well for registered radiographers. So let's talk about clinical. So our programme, I think, offers 50% academic and 50% clinical split. So what that means is that you'll have an academic block for first year up until Christmas. So in that we'll get you in the practical X-ray room, where we'll teach you how to position for different general X-rays. We'll also teach you your anatomy. We'll also teach you a little bit of physics, so a bit about radiation protection, because you will be going out using radiation in your clinical block, and how to utilise that safely. and take into consideration like pregnant women or patients who are sort of in childbearing age. And then after Christmas, you'll have a 6 to 8 week block of clinical where you'll put all of that into practice. And then you'll have another academic block, another clinical block. So a bit like some of the other professions and programs, we get you out in first year. So January for first year is when you'll first go out into clinical. Now, to support your learning, as well as the practical X-ray room sessions, you will also have virtual reality sessions as well. We've got headsets. So in groups, you will learn, we have a virtual reality X-ray room where you can practice moving the tube, X-raying different body parts. So it doesn't matter, it's like a safe learning environment. So it doesn't matter if you over-irradiate the virtual reality patient, because if you make all like the mistakes and things that you should do there, it's a safe place, and then you can understand how that affects the patient, what it does to the image, so you know whether you've over or underexposed those. So we've got lots of equipment to sort of help support you, and that's what so when you then go out into clinical, you won't feel like a rabbit in headlights. You'll already know how to do the positioning, know how to use the equipment. The only difference is that it's a real life patient. So our clinical placements, we go by health boards. So you'll get a different health board each year, and they arrange across the M4 corridor. So we can go as far as the Naira Bevan, so that covers up to Abergavenny, all the way down to Newport. We've got Cardiff and Vale. We've also got the Cwmtaf, so that's in the middle, all the way to Neath and Swansea, and then as far as Haverfordwest as well, which include like Carmarthen and Withybush. So it means that you'll get a range and wealth of experience in different health boards and rotation, and you can and so it'll emulate sort of what you'll see out in practice. And also you will do the shift patterns of the radiographers as well, so you'll know what a day in the life of a radiographer is. You'll understand the shift patterns and can see if it's for you. Okay, so we also offer the simulated clinical placement, or SCP week, in your clinical, and basically these are scenarios are run. So it teaches you how to interact with and adapt your care to sort of a patient who's deaf or who's blind, or maybe has got dementia and is frightened. So hopefully then you'll know how to deal with these situations and feel prepared in placement as well. So I'll probably sum up because I realise I'm probably waffling now. So we've also got dedicated clinical tutors who are academics as well. So we'll support you in clinical and just pop in once a week to sort of see how you're getting on. Most of our staff are actually still clinically practicing as well on what we call on the bank or doing agency work. So it means we're really up to date, and especially in a fast-paced, ever evolving profession. So we're up to date and current with knowledge, with current new technology and practices as well. So you'll get really up to date knowledge and sort of experiences. So we've got quite a lot to offer, and we offer like pastoral support. And because we're quite a small team, which I know sort of OTR and Radiotherapy and Oncology are as well, I think you get to know us a bit better. So that means then I think hopefully that will make you feel more comfortable. You can come to us if you need the support, and we can sort of signpost you to different things. So our range of teaching assessments are quite diverse. So we test a lot of different skills. So you'll have there's a written essay. We do OSPEs, which are like online. They're like exams, but they're sort of electronic exams, but they're image viewing. So you've got to either sort of label the anatomy on images or describe and label the pathology and things like that. We also do in clinical, we do clinical exams. So clinical exams. So where you apply your knowledge and have to like take an X-ray on your own and talk about some of the safety things. and you'll have an electronic clinical portfolio to complete as well. But we take you all through that, so nothing should be sort of a surprise. And then just to sort of tie up with entry requirements, please look at the QR codes. But the one thing that isn't on there is that this year we're accepting PE or physical education as a science. So we require at least one science at a level B or B grade. Or equivalent, but also we include not just chemistry, biology and physics, we also include psychology in that as well. And this year it'll be PE, but it's just not on the website yet, so apologies for that, but we're going to hopefully update that soon. So thank you so much for listening. I know I've probably gone way over time, I do tend to waffle, but if you do have any questions or you wanted to know anything more, please email the HCare admissions team at cardiff.ac.uk, and they'll forward any questions on to me. So, and please have a look at the QR code with further entry requirements, and for any other sort of BTEC qualifications or level 3 sort of higher education certificates you're unsure of for entry requirements, just email any of our professions and we can let you know. Thank you so much for listening to me, and I hope you have a passion for any one of the programmes here today, and hopefully we can welcome you and see you at Cardiff soon. Thank you very much. I'll hand back over to you, Gareth.
Gareth, you're on mute.
Gareth, you're still on mute.
Okay, can you all hear me now?
Yes, we can.
Oh, right, okay. Yeah, so what are the key elements of a good personal statement for AHP programs? So this is a very generic overview. Obviously, you've got to ensure that it's quite personalised to the profession that you're applying for. But in a nutshell, first and foremost, I would suggest is that you understand what is meant by fitness to practice, and there's a link there for you. So in general, my question to you would be, is this course right for you? Okay, it's patient facing. Okay, the physical elements associated with the profession. Okay, and health wise, are you fit for this particular role and what you're going to come to face with on a day-by-day basis? Okay, there's 3 questions that obviously apply to your personal statement. So understanding the profession you're applying for, what you know about the profession, what have you done to explore about that profession, your motivation for the course and the university, what have you, how was your education experience to date can prepare you for university, and what transferable skills do you have? What can you demonstrate, for example, in terms of jobs or hobbies, experiences outside the school environment that can be used to apply for the different roles and professions. Okay. So I'm going to put a question to the panel that I have tonight. Okay, and this is another common question we get. So I'll go around, or I'll just ask people to come forward what the expectations for an AHP student each year of the degree. So I just wondered if someone would like to elaborate on this. Is any admissions tutor willing to come forward to answer that question?
Hi, Gareth. Yep. From a professional point of view, I think it probably is similar across the other profession groups. There's that we have a kind of a scope of practice or a code of conduct to follow. So for physiotherapy, you'll find that on the CSP, and I'm sure you'll find that on some of the other kind of groups that the other programs have mentioned as well. So thinking around professionalism, professionalism is something that we carry through the programs as part of our teaching. So thinking about things like communicating effectively, thinking about confidentiality, thinking about respect, dignity, equality, diversity, all of those elements. And we really start that at the very start of the programme, and we use that as a common thread, not just through sort of our classroom teaching, but also through our practical-based teaching, because that obviously goes then into professionalism, because ultimately these are vocational programmes that lead people into the profession, and that is how we're wanting our students to kind of, and our graduates to act once they reach their professionalism. Does that sort of answer your question from that first point?
To me, it does. Yeah, thank you very much. Okay. Also, you are applying for a professional degree. You're going to come out hopefully as an allied health professional. So, go take into account your engagement with your academic work and your clinical work in terms of timekeeping. So I always tell our students that your interview starts from the very first year, because people will be watching you and looking out for those students they want to employ at the end of the degree program. Also, don't forget, it's that you read for a degree. You just gain a degree, don't come out and gain, you read for a degree. So think of the academic workload to consider when it comes to your assignments or any written or just reading on the subject, gaining the wider knowledge. You're not going to be spoon-fed. You're going to be responsible for your own learning. And in taking those 3 bullet points, it comes to attendance. Right, I'm going to stop sharing the PowerPoint, and I just want to open, is any questions or answers? So I'm just going to the Q&A. And I might have to delegate to the panel based on the questions. Let's have a look what we got. Right, someone's asking, I don't want to come forward, what does NHS funding cover? Anyone willing to come forward with this one? Or has someone already answered it?
Just say, Gareth, I have linked to the website in answer to that question.
Thank you.
But for anyone who is watching on a recording and can't click a link in the Q&A, if you Google funding a healthcare programme or funding a healthcare course, Cardiff University, it should take you to a page which has got everything you could possibly need to know and all the links that you need.
Yeah. Okay. I might point out to the student that we have on the panel for the next one, so be prepared. Okay, so the question is, what extracurricular activities are there in terms of societies like within the Students' Union? I think from my last recollection, there's a plethora of clubs and societies you can join. In fact, there are things I've never heard of. All right, but I'm just wondering if our esteemed student can elaborate on that question, please. I'm sorry, Jodie, I forgot the name of your student that's on the panel. No? We haven't got a student? Okay. So
no, we don't have a student today.
Oh, right. Okay, sorry. I apologise for that. I'm sure you will. I think there's a link to the Students' Union where there's a list of different clubs and societies that you'll be welcome to join and explore, particularly during your first couple of weeks at Cardiff University as you get settled in. Okay. The next question then was, I'm not sure, I think it's been answered in terms of how much patient interaction, and I can see Erica's answered that one, and I think that will depend obviously on the placement, also the profession, on the clinical, what profession you've embarked on, will be very much dependent on that. Okay. What is the most common imaging that you perform? so I think that's related to diagnostic radiography. So Gemma, would you like to come to that one?
It's very hard to say, but we say, I think probably the most common is chest x-rays, because they're the most important sort of, with a chest condition or pathology, it can change so quickly from being you're okay to actually you've collapsed. So I would say the chest x-ray, general chest x-ray is the most common, but obviously CT head is the next because of all the CT head trauma, not just trauma, but also we do CT head scans for things like diagnosing dementia, among various other things. So I say chest x-ray followed by a CT head. I think there was another one as well after that, Gaz, about what does a typical day as a radiographer look like. So I think what I'll do is that I'll answer that from a diagnostic point of view, and then I will hand over to Erica, because obviously a therapeutic radiographer's day-to-day typical day is different to ours. So I think at least if you get both sides of the coin, you can decide which radiography profession's for you. So diagnostic radiography, no day's the same. So like I said, one day, on Monday, you could be up in theatre imaging all day. On Tuesday, you could be doing general x-ray, so that could be in A&E, or receiving patients from fracture clinic or urology clinic or rheumatology clinic, any clinic you can think of. You could have GP patients walking in as well. So that could be your Tuesday. Wednesday, you could be, as a band 5 now, you're expected to know how to do a CT head, so you could be doing those, because obviously you'll be doing night shifts as well. A&E doesn't stop, so and nor does the imaging. You're still going to have people come in at 2 in the morning that need a CT scan or a general x-ray because they've gone and had an interesting night out and sort of broken their ankle. So the shift patterns are different as well. So it depends what area that you're in. So you can either be Monday to Friday, 9 to 5, or you can do or you can do late shifts. So you could be like on a 11 till 8 shift. You can be on a 1:10 shift. You could be on a 4:30 to midnight shift, or if you're doing night shifts, you can do 12 hours. So you could do 8 o'clock till 8 in the night to 8 in the morning. In some places, if you're working in CT or MRI, you might typically be able to do 12-hour shifts, so 3 long days. So I think it just depends on the hospital and on the shift pattern there, but you will be expected to work out of hours and night shifts as well. But like I said, no. For a band 5 radiographer, the areas you're more likely to go in are general x-ray, fracture clinic, doing CT heads if it's in on a night shift. Theatre is a massive one, and fluoroscopy. So when I talk about fluoroscopy, I mean that's live imaging, and you're working with the speech and language therapy team probably, and looking at if someone's not swallowing properly or having problems with the stomach and the bowel. We do live studies where we can look at transit studies and how things are being swallowed, and if there's an issue there, and can follow it through. So as a band 5 radiographer, that's where you're mainly going to be working. And then if you want to specialize in sort of MRI, nuclear medicine, and all the other things, other modalities, then obviously that you've got to have your bread and butter first before you specialize. So I hope this answers your question from a diagnostic point of view. Erica, did you want to come in and talk about the therapeutic radiographer's day-to-day role?
I'll just add a couple of things, Gemma, if that's okay. With radiotherapy, we work within teams. So we are very likely to be working in a particular linear accelerator room for a short period of time. So we rotate through the department, so learning different skills, because each linear accelerator is different and we have different patient specialisms. So we are more likely to work a standard week than diagnostic radiographers are. So we do work shift patterns, and those shift patterns tend to be through the day. We tend not to work through the night. That said, we do have emergencies in radiotherapy, so usually somebody will be on call and does have to come in to treat patients as an emergency. It depends very much on what your role is. So on each of the linear accelerators, as well as treatment radiographers, you'll have specialist radiographers. So these specialist radiographers could be specialists in imaging. Yes, in radiotherapy, we image as well. So they could be offering guidance to different staff depending on particular needs. We have particular specialisms where perhaps you might work in something called treatment review, where you offer specialist advice to patients. So you tend to specialize as you become more senior, but for most radiographers, they would work in small teams where we support each other. Because we are given very high doses of radiation, then it's really important that we work in teams. We continuously check each other because obviously we have to get things perfect. We have other pieces of equipment as well. So we have something called brachytherapy, where we treat from radiation inside of the patient's body. So we have radioactive sources that we position in different parts of the patient's bodies. And for that could be ward-based or certainly theatre-based. So there are lots and lots of options for therapeutic radiography. But I think possibly the biggest difference is that we tend not to do the overnight work. Thanks, Gareth.
Okay, thank you very much. I can't see any other questions. Has any presenters like to add anything additional to their PowerPoints? Okay. All right. Well, thank you very much, and I want to give a big thank you to the team here tonight who have given their time to give a tour of the School of Healthcare Sciences and the Allied Health Professions tonight. Also, if you've got any questions, there are links or email addresses you can contact us individually should something come to your mind about our program or our program that we deliver here in Cardiff. But good night and thank you very much.
Bye, thank you.
Thank you.
Thank you. Bye.
Bye. Bye.